in your Gaussian distribution, but the upper end is skewed in upper end, and the range can derive by turning the log of data and just by considering 2.5th or 97.5th percentile in a population that is being studied. Now, the variation of laboratory test ranges. For a laboratory test, reference range, it usually covers 2 SDs from the mean value. It means that 1 in 20 healthy people will have a test result of reference range. Now, these ranges vary from labs to labs, and they can change if new evidence is available, and the lower and upper limits are not absolute in the range, and they can't define any abnormal or normal results. But there are certain points which is the possibility of certain situations may rise. So some of the reference ranges depend on the changes from international bodies to optimize the outcome of patients instead of statistical distribution of the population. For instance, the upper reference range is based on guidance in TSH of early pregnancy stage for serum uric acid in patients having treated to lower uric acid. So the limit depends on the guidelines of your European League against rheumatism. Now, the interpretation of results out of given range depends widely on your clinical background of patient and clinical questions and pattern of your other abnormal ranges. Now, now next is your individual changes. So health status, diet, your lifestyle factors of patient, they can have pre-analytical influence of lab changes. So nutrition and diet, like first factor, the calorie restriction, fasting, your malnutrition, food exclusion diet, and dehydration, they are responsible to affect lab results. And in some laboratory tests, their significance may depend on certain dietary factors. So it is vital to ensuring the sample gluten in the diet for several weeks before your serology test for celiac disease patients, or fasting before checking effect of an investigation in a patient with high triglyceride levels. So assessing diet factors in some cases can help interpret unexpected results, that is a vegan or vegetarian diet, which may reduce vitamin B12 levels and increasing ketone levels, and a high protein diet and can increase uric acid levels due to low carb diet. So let us suppose the fasting condition. So up to 12 hours of fasting before laboratory test may help to get most accurate result in these laboratory tests, and according to clinical scenario, which may affect by taking certain food like uric acid. There is no need for fasting for accurate results, but recent diet intake may help determine unexpected outcomes. In glucose, only when indicated. So these days, HbA1c for most patients is recommended as the first choice of test in monitoring and diagnosis of type 2 diabetes. So they do not need fasting. While in case of TG, fasting is not necessary for most patients in lipid testing, and it may recommend monitoring high triglyceride levels in individuals. So in creatinine level, for measuring creatinine levels, high amount of meat in a recent meal, it can affect serum creatinine and test significantly, and it must in mind when testing for monitoring EGFR levels. So starvation and low caloric intakes, it results in some changes to parameters like thyroid, your glucose, your renal function, liver functions, and lipids. So the levels of uric acid may increase due to ketonemia, which is the cause of lower clearance. Now, dehydration, it can be the cause of potassium and sodium imbalances. It can also affect several other indicators like urea and creatinine, hematology, lipids, etc. Now, malnutrition, it is having different effects on lab results, and according to the nature of nutrition status of a patient, malnutrition is considered as a lack of energy and protein and without deficiency of your micronutrients. So, however, the malnutrition is defined as overnutrition and undernutrition or deficiency of a nutrient. So malnutrition is known to be the cause of results like reduced ferritin folate as well as in levels of your vitamin B12. Now, alcohol on laboratory tests, the effect of alcohol may vary on extent and duration of use. So, if there is transient or acute effect of consumption of alcohol, that is within 2 to 4 hours, and include increased plasma lactate and serum glucose with lower excretion of uric acid, because taking hepatic gluconeogenesis, here are the chronic effects of consuming alcohol on laboratory tests. So these are the levels of GGT, that is your gamma glutamyl transferase, as well as mean cell volume, that is MCV, which are widely using test for high alcohol consumption. Your ALT, that is alanine aminotransferase, or AST, aspartate aminotransferase, or ALT-AST ratio, and ferritin and uric acid because of alcoholic hepatitis and fatty liver, creatinine kinase because of alcoholic myopathy, and other abnormalities like thrombocytopenia and anemia. So consumption of alcohol, it can also have a vital role in deficiency of minerals and vitamins, and the effect may occur due to replacement of food consuming with alcohols and vitamins like lower levels of your vitamin A, folate, vitamin B, and your calcium. Now, caffeine, when we discuss lab parameters, there is no complete study on the effect of caffeine. So, it is having a short lifespan of 3 to 7 hours, but it varies among people. So, consumption of caffeine can cause elevated levels of blood glucose level. It can also affect investigations like metanephrine's interpretations, and when it comes to investigating your hypertension. So the timings of investigation in case of illness, the significance of investigation, it relies on the time of the sample taking to the stage of disease. Now the selection of right investigation, it can also influence the stage of illness. For instance, serology test, it may be negative for syphilis, and in case of sample is taken for exposure too early. So people are different types of there are different types of serology tests which provide details regarding past or active infection. So acute illness may also affect the results of your investigation. For example, if there is a case of acute protein phase levels, it can increase by infection and inflammation, and along with malignancy and chronic disease. So in case of smoking, exposure to nicotine and smoking can have both chronic and acute effects on investigations. So within 1 hour after smoking, up to 5 cigarettes, serum or plasma concentrations in fatty acids, glycerols, adrenaline, cortisol, and aldosterons may rise. So chronic smokers may have significant rise in your leukocyte lipoproteins. So heavy metals, hematocrits, your tumor markers, and your reduce in activities of enzymes. So next will be your exercise. On laboratory parameters, the effect of exercise depends on your health status of the patient, intake of water and food, or during after or during exercise. So vigorous or extreme exercise in a person who is not familiar with this activity level may cause changes in some lab parameters, and it may cause changes in some of your lab parameters, and in these patients, for instance, most common cause of increase in creatinine kinase level is exercise. So creatinine kinase levels, it can elevate due to intense exercise for several days to weeks. So thyroid function is also supposed to change among people who are going through the high intensity workout. So for instance, FT4 and TSH levels can increase in anaerobic exercises but reduces FT3. So AST and ALT levels, they can also rise after a workout. So after a workout, hematuria and transient proteinuria, they are also common, but uh, they resolve after a couple of days. So there are some other analytes that can be raised by exercise, and those are as follows, like urea, creatinine, prothrombin time, lactate dehydrogenase, D-dimer levels. So the activated partial thromboplastin time, that is your APTT, and fibrinogen, they can reduce. So most of those effects may be transitory, but it depends on your individual health factors. Analytical changes, if I say, so these variations take place due to error in your test methods, as in your equipments. So it may cause a slight difference in analyte value and at every time of your measurement. So lab equipment and modern test methods mean more accuracy in lab test results. So usually variations in measurement should less than half the biological variation of the patient. So after collection of a sample at the practice, it is vital to know about the type of container as well as the medium of the sample for the specific test, and it can also affect the lab results. So for instance, a PCR testing swab, it should move in a dry tube with your viral transport medium. So blood testing is one of the least transparent and most misunderstood parts of your medical science. So we simply simplify that with easy to understand results and affordable testing you can do at home. So this was all for the factors affecting your clinical diagnosis. So rest, we'll try to, this is it for your topic, and rest we'll try to figure out in your next lectures. So that was all for today. So we'll meet in next